Journey Through Parenthood with Martina Bills.
Brought to you by Southern Ohio Medical Center. Very good things are happening here.
Good Wednesday morning, everyone. I'm Martina Bills. Thanks for joining us here on the WSAZ Now desk for Journey Through Parenthood. Well, this morning on this Wednesday, we are talking about ovarian cancer. We're kind of raising awareness with an OBGYN doctor at Valley Health, Dr. Caleb Huff, because this is one of those difficult to diagnose illnesses. And that one of those reasons is because there's no specific screening test for ovarian cancer like a woman would get a mammogram to detect breast cancer. So Dr. Caleb Huff with Valley Health is here to tell us a little bit about a woman, what she needs to know just to make sure everything's okay, and how to get a diagnosis if that is the case.
So very simply put, ovarian cancer is cancer of the ovaries. It can start in the ovaries or it can start in the fallopian tube. Ovarian cancer is a leading cause of cancer in the United States, as well as a leading cause of cancer deaths. So it is a very important topic to discuss.
Okay, so let's talk about kind of raising awareness for ovarian cancer. What are some signs or symptoms that a woman would be able to maybe keep in the back of their mind just to be certain to kind of know your body type thing?
Right. So unfortunately, with ovarian cancer, a lot of the symptoms are nonspecific. So those can include abdominal distension, constipation, or diarrhea, feeling full very early, having urinary frequency. It can be pelvic pain, abnormal bleeding. All of these things can be symptoms of ovarian cancer.
Okay, and I know those are kind of symptoms that could be other things too. So this seems like it could be like a tricky type thing there, trying to get a diagnosis. How do you receive a diagnosis for ovarian cancer? What are the process like with when a woman does come to you having some issues?
So if somebody presents to the office and they have these complaints, the first thing we'll do is go over a detailed history and figure out how long you've been having these symptoms. Most likely then we'll do an exam, which would involve a pelvic exam. And that is to feel the pelvic organs to see if there's any enlargement or abnormality there. If there is, I may order a pelvic ultrasound, which can show abnormalities of the ovaries, the uterus, anything that could be suspicious. I may order some lab work. There is a marker called a CA-125, which can be elevated in ovarian cancer, but it is a nonspecific blood draw. But if those are elevated and I'm concerned for ovarian cancer, I would refer the patient to a gynecologic oncologist who would then plan surgery. During the surgery is how you get the diagnosis. So it's diagnosed surgically and staged surgically. And at that point, after the surgery is performed, the oncologist will determine if chemotherapy is necessary at that point.
Now, are there any tests that are done beforehand routinely that checks for this kind of illness?
No, unfortunately, there are no screening tests for ovarian cancer. So we as OBGYNs and other primary care doctors have to have a high suspicion for this. With all of these nonspecific complaints, we have to kind of connect the dots and look into things a little bit more closely to see if there is a concern for ovarian cancer.
Okay. What about the risk factors that play into ovarian cancer? Who is at risk? Is there a certain age group or anything that plays into that?
So any woman who has ovaries is at risk for ovarian cancer. The risk in the United States is about one woman out of every 70. There are some things that can increase the risk: being overweight, never having had a baby, having your period very early age, or starting menopause very late age, a history of endometriosis, or a family history of breast or ovarian cancer. All of those things can increase your risk of developing.
And that's what I was going to ask about, that family health history that we always talk about with illnesses. How does that play a role with ovarian cancer?
So most ovarian cancers are not related to family history or genetics, but if you have a strong family history of breast or ovarian cancer, that is an important thing to talk to your doctor about, to see if you are a candidate for doing genetic testing, which can see if you have some of these certain genetic conditions that can increase your risk of developing ovarian cancer.
And Dr. Huff, just talking with you, I know that I feel like it's one of those cancers you don't hear as much about as other cancers that, make headlines all the time. What would you say raising awareness, because it isn't one of those cancers that you hear so much about? How would you like to raise awareness?
I think because it's so difficult to diagnose, and oftentimes when it is diagnosed, it's further stage. So I think just being, like you said at the beginning, being aware of your body and changes that may be happening, and not being paranoid of every little thing that may be different, but being aware of, if you feel like your abdominal, you have abdominal distension, and that's a new thing for you, or unexplained weight loss. You just don't understand why you're losing weight, or you don't feel right. And some of those things you can just bring up to your doctor and just be reassured, that everything looks fine, and that way we can catch things early if there is something to be worried about.
So Dr. Caleb Huff, an OBGYN physician with Valley Health, says that about 1 out of every 70 women in America are diagnosed with ovarian cancer. And it's one of those trickier cancers to diagnose because there's no specific screening test like, say, a mammogram for breast cancer. So if there's something that you think is wrong with your body, always listen to your body. Doctors tell you that all the time, and then bring those health concerns up with your doctor, and they'll go through the process of running tests, because there's no specific screening test for ovarian cancer. And it's really one of those cancers that you don't hear so much about as you do, say, breast cancer with the pink ribbons during the month of October, and the ovarian cancer ribbon color is teal, and you really don't see much of those about. So we're kind of just raising awareness of what women really need to keep in mind, just to make sure that their bodies are healthy. And always, if you have any kind of concerns, bring those up with your doctors. Here on Journey Through Parenthood, you can always reach out to me on social media. You can find me on Instagram, Facebook, and Twitter. If you have any questions or story ideas, you can share here on Journey Through Parenthood, and maybe we'll present it as a topic here on the WSAZ Now Desk. We're here every Monday and Wednesday at 10 o'clock. We hope you have a great Wednesday. Have a good one.